When disaster strikes, what do? We rush to provide water. We rush to provide food, shelter, medicines, vaccines, and education. We look at the physical health and well being of children. Yet, we often forget something just as vital: their mental health. Children who have lived through disaster, displacements, or violence carry invisible wounds: anxiety, depression, fear, and hopelessness. Adolescents face unique pressures such as disrupted schooling, uncertainty about their future, and the loss of their support. If we ignore mental health, we risk undermining everything else we do. Mental health is a right and not a luxury. When children's mental well being is neglected, their development, education, and relationships suffer. Stigma and exclusion only make things worse, and caregivers under stress struggle to provide the stability and nurture preparedness and response plan, supporting children, adolescents, caregivers, and frontline workers before, during, and after crisis. Promoting mental health and well-being and preventing distress are just as important as providing care. Let's strengthen the links between community-based services and formal mental health care. Humanitarian aid must go beyond survival. It must help people recover, build resilience, and find hope again. That starts by integrating mental health support into every response, and this isn't just the job of the health sector. Teachers trained with the right tools, such as HAT, can spot distress and help students keep learning. Caseworkers can link families to local mental health services for protection and welfare. Frontline health workers can identify mothers showing signs of postnatal and postpartum depression and refer them to appropriate care. And during emergencies, every cluster can create safe spaces for emotional recovery. Let's take a moment to reflect on what today's theme truly means. It's a powerful reminder in every emergency, whether it's a flooding, a conflict, a health crisis, children, adolescents, caregivers, and frontline workers all deserve access to quality mental health. This isn't just a nice to have, it's a life saving intervention and should be the backbone of effective humanitarian action. A multi-sectoral approach means that no child is left behind, whether they're in a health facility, a classroom, or a displacement camp. Integrated support helps children and families develop healthy coping skills, strengthens parenting, and promotes resilience and nonviolence. Pakistan has shown remarkable resilience in the face of humanitarian challenges. The lessons from COVID 19 and the recent floods show us that mental health must be woven into every stage of preparedness, response, and recovery. When we make mental health a priority, we are not just helping people cope, we're safeguarding dignity, building resilience, and laying the foundation for recovery and sustainable progress long after the crisis has passed. So, as we celebrate World Mental Health Day, let's turn these words into action. This means, first, let's make mental health support for children and adolescents a top priority, everywhere, in every sector, and especially when emergencies strike. This means supporting not just the children, but also their parents, caregivers, and teachers, so no one is left behind. Second, let's design our emergency plans with children at the very center. We must listen to their voices, understand their unique needs, especially those of girls and marginalized groups, and make sure our response is truly inclusive. Thirdly, let's stand up for the rights and dignity of everyone facing mental health challenges. No matter the crisis, protection and respect are non-negotiable. And finally, let's empower children, young people, and their communities. Let's invite them to the table, involve them in decisions, and help them rebuild their lives with hope and dignity. Together, we can ensure that every child, everywhere, has the right to care, to dignity, and to hope, no matter what they've endured. Thank you very much for your attention, and congratulations to the new graduates.